Ivy. Thank you for joining me for this online interview. Can you tell a little bit about yourself for our viewers?
I've lived in Greenville since 1990. I have to stop and think. I've lived in Greenville since the early 90s, and I came here to go to ECU and stayed. So go Pirates! I'm actually back in school for my third degree now from ECU. So I've decided to get the final. I think it'll be the final degree. And currently, I work at a local pediatric office. I have a photography business here in town, and I have a lot of passions for children and being involved in volunteer activities and just trying to give back to the community.
So, you work as a nurse practitioner, right, at the local pediatric office. Why you pick this profession? Why it's your passion?
So I was a nurse for a while, and I felt like I wanted to do something a little bit different. And I truly prayed about it and sent an application in, and I was accepted. And wasn't sure I was going to end up in pediatrics, and a job became available, and they took a chance on me, and I've been there almost 13 years now. So.
Wow. I wanted to ask you about your project, Blessed and Healthy Families. Why you started this, and can you tell more about the actual project? What is it?
So, Blessed and Healthy Families is a small but growing little group that I started out of a need for helping local families learn how do they manage um, as far as being healthy overall. A lot of our children, we're finding more and more are having increased BMIs, and this is a big issue in Eastern North Carolina that we need to address. And a lot of parents are receptive to that and want to address that, but they may not have the tools or the knowledge to do that. So I actually attended a class of about 2 years ago that sparked my interest in obesity medicine. And I didn't even know that that was a separate area that you could join and do and in medicine. And I started pursuing a certificate of advanced education in that, and I obtained that, and then I started the project. And my hope is eventually to become a nonprofit, to where I can do more activities and offer more things for our local families. Currently, I have done a few things with, for example, kinetics, physical therapy, and wellness. We did a joint project for 6 weeks. We had children come and their parents as well. And their parents learned about nutrition and how to help their children eat healthy and make good, healthy choices overall. And the children actually got to have a lot of fun and do different activities and learn how can they make healthy choices themselves, and how can they exercise at home, because some children don't know that. A lot of our schools have cut down on physical education, so children need more activity at home. And of course, we've increased our technology. Even before COVID, we had done that. So children need to have less time with that, a little more time outside. And so that's one of the things we're hoping to do. I've also been able to do a project called Moving with a Provider. And we were really getting that started, and then unfortunately COVID kind of happened, so we're having to delay that a little bit. But we've been able to still share some information and educate our families. But basically on Saturday mornings, different Saturday mornings, I meet with families, whoever can come, and we exercise. We had yoga scheduled one morning. So we've got several different things in the works for that as well.
That's great. You mentioned that COVID affected your project somehow, but how has it affected your life in general? Can you share more about this?
So I think for all of us, it's sort of like we woke up one day in a totally different world. And I think it's an adjustment for everybody. We have changed a lot in our practice as far as offering well visits at certain times and sick visits at certain times, just to make sure, and of course reassurance to parents as well, that we try to create a safe environment for them coming into the clinic. And then more telemedicine, which I had actually started doing a lot for our practice already. So I was a little more comfortable, I think, than some jumping into that role. But more parents are wanting to utilize that. I think we're going to change the face of medicine with that. I think it's here to stay, and I think we're going to see that being utilized in ways perhaps we didn't think it could be utilized.
What precautions do you take when you go to work, when you come back home? How this routine changed? What measures you do to prevent catching this virus?
So the number one thing everybody can do is good hand washing, and I was always kind of a OCD about that in general, but I definitely am doing that more often, even in my own home. Just if I go out and run errands and things like that, I'm a little more cautious, and I rarely run errands anymore. I've figured out, okay, online shopping, picking up things, and I think a lot of us have adjusted to doing that. But for me and many nurses and other healthcare providers, when I come home, I mean, I was already, no shoes in the house, change clothes pretty quick, but now it's pretty much there's no, hey, let's go out to dinner tonight. Because we can't go out to dinner necessarily, but B, because it is a risk to us, and it can live on fabrics and things like that. So we want to be situationally aware and not in a panic is what I call it. And so for me, I come home, it's, scrubs. I've started back wearing scrubs now. They're a little bit easier to wash and maintain. And the scrubs are in the laundry. That's actually, I was joking with you earlier about hearing the machine running. And then it's straight to the shower, wash the hair, nothing that I take with me comes into the house. It stays more in the laundry room, and everything's cleaned, just so that we don't bring that into the home.
Mm-hmm.
And a lot of parents, especially with children at home, they're having to be a little more cautious with that. And we clean some. I mean, we do a really good job of cleaning and everything like that, but there's still contact for us with patients, so we have to consider that.
How do you explain it to your patients, to kids? How do you explain this situation?
As far as what's going on, I mean, I think we talk a lot about that. I talk with a lot of the children. How are you doing? Are you adjusting to online school? Do you miss your friends? Have you figured out a way to communicate with your friends? Because they still need that interaction, although they don't need to go over and have a play date. They do need to have times that they can call their friends or FaceTime with their friends or different little activities like that. And so we talk a lot about how are they coping, how are they adjusting, and a lot of them know, they've heard through the news, or the parents have told them, it's a virus, and it's we need to wash our hands more, and we talk about that. Or I do, are you washing your hands more? Do you noticing the happy birthday song? Sometimes parents will even jump in and say, look at how she's washing her hands while I'm washing in the clinic before I see them. So a lot of just education and talking about what are you doing? Are you, to be safe? And are they doing okay mentally? Because this is a different world we live in. For adults, it's harder for us to cope too, but children may not always demonstrate some of the signs, and they may kind of hold it a little more inward. So we just need to make sure we're open and talking with them a lot.
What do you think about social distancing? Is it effective? Do we still need to continue doing this? What is your opinion on that?
That's a loaded question. I think I sort of sit in the middle on some of it. I do believe in social distancing. I think we need to do it. I think that we have seen that it has helped. I think we're going to have to continue that for a while. I think a lot of people really feel like it's time to get back to quote unquote normal, but the reality is I think we're going to have a new normal. And I think people need to talk about that a little bit more, and we need to discuss that. However, I also have a small business, and I don't rely on that totally for my full income, but other people do. And I think we have to find the balance for them so that they are able to get back to work and have a steady income, and we have to provide for their families, and I certainly understand that. So I think we have to come up with a balance, and we may not find the right balance, and we may see our numbers go up and we have to readjust. But the reality is, I do believe in social distancing. I think we need to do that, and it needs to be done in a healthy way. So, I tell people all the time, if you have elderly parents, call them, or, let the kids call the grandparents, or do a drive-by and wave. There has to still be that human interaction. We need that. But we may be continuing this for a little bit longer, or the governor may decide in North Carolina, hey, I'm going to open up like other states. And if we do that, I still think we're going to have to practice a lot of the things that we're already doing, as far as when you go to the store, keeping the distance, or trying to do the online shopping, or trying to be a little more aware of those things.
Thank you so much, and thank you for this interview. And I just wanted to ask you if you want to tell anything or send any message to for our viewers today.
Well, first of all, thank you for asking me to do this. I feel honored. And I just want to say, everybody, hand washing, hand washing, hand washing. I say that all the time to my kids. So I'm going to say that to you guys too. And just be careful, be safe. And I can't wait to see what Greenville does when we kind of start our new normal. And I'm excited about some of the changes. And I've definitely seen everybody coming together again, as we always do in a crisis. So that's always a great thing, and a great reason for being a part of Greenville, North Carolina.